but what was it like for you to be so well trained in the establishment, in the medical system, and find out that what you were told, what you were taught, wasn't necessarily the best thing for like you said, prevention? That would be, I don't know, that would be a tough pill to swallow. Forgive the pun.
Yeah, no doubt. It's most medical doctors. I mean, obviously, they're very brilliant men and women who go into this profession to become cardiologists and medical doctors in general. But again, we only know what we know. So it's kind of like I would say, hey, listen, if I went on the job and I was being an apprentice for a plumber, and the plumber would ask me to do something, I would look like an idiot because I know nothing about plumbing. And the plumber may say, wow, this guy is an idiot. Well, again, I'm not an idiot. I've just never been trained in that. And again, the medical doctors are just not trained in causation. They're trained in, you have high blood pressure, here's your pill. You have abnormal cholesterol, here's your pill. You've got coronary artery disease, here's your pharmaceuticals. Let's do a stress test and a stent and bypass surgery. But ultimately, a lot of doctors are not going to listen to what is the truth about health and wellness, because again, their entire career was spent learning something else. They're not going to admit that that was a wrong model to follow. And then number two, they're financially incentivized to prescribe pharmaceuticals, to see a lot of patients quickly, to do these surgical procedures. And then number three, the scrutiny of the medical boards and of your colleagues. So if you kind of step out of the box like I did, again, I took a lot of stones from the people in my old cardiology group, and on a national and on a worldwide level of people who would say things about me and make complaints about me. But again, it's that's all part of the process. And the more of us holistic practitioners who tell the truth and shout it from the rooftops, that's how we're really going to change, because pharmaceutical companies and the medical establishment that they control, they're very powerful. So the truth has to be spoken, and if we do, it'll prevail.
Yeah, no, that's great. I love that. And I'm glad you brought that up, because you were experiencing some pressure from people either above you or adjacent to you in what you were doing, saying that you're not earning as much money as you were when you were doing more of these procedures and prescriptions. Is that correct? Do I understand that right?
Yeah, I mean, again, when you're in the big cardiology group, you're incentivized to see patients very quickly, people very quickly. And then you're incentivized, of course, to order tests and procedures. So when you order stress tests, when you order ultrasounds, when you order angiograms and pacemakers, again, all of that is how the doctors get reimbursed. Yet my new patient consultations these days are 90 minutes long, because we have to discover a lot of things. And again, in the traditional medical model, that visit was less than 10 minutes, and now it's 90 minutes. So you really can't practice insurance-based medicine or health when you're a holistic practitioner. When you opt out of that, you typically don't accept insurance, only because, again, you have to be able to see people for a long period of time, and none of that should be kind of guided or limited really by insurance companies.
Yeah, you mentioned a difference between chronic care and more like acute care or care in an emergency. As you look back on the things that you were taught and the procedures you were doing before, what are maybe one or two examples of things that you look back on and maybe cringe a little bit now to think like, we probably did this in more cases than it was needed?
Yeah, that's a great question, Casey, and thank you for asking it. And undoubtedly, stress testing is the number one thing that comes to mind. Again, annual stress tests on people. We order it all the time, so do most cardiologists, and there really is no scientific value to that. All there is risk. Risk really twofold. Number one, the radiation risk of doing a nuclear stress test, and then number two, the false positive rate. So let's say a stress test is done, and the test is abnormal, and then it leads you to the next step, and maybe that's an angiogram, and the angiogram maybe is normal, but you put the person at risk of doing the angiogram when they really didn't need it. So I could talk a lot about all of the mishaps and really malpractice inside of the cardiology realm. There's a lot of it going on. And again, it's just so unfortunate that the people suffer, and it really is just a revenue grab. There's so many examples of that, of what conventional doctors are doing, and there really is no value to it.
That's a really strong statement to talk about like malpractice. But we got the same sort of answer from Dr. Thomas Seyfried, who's at Boston College, I believe Boston University, and he's studying cancer. And he talks about treating revenue creating diseases. These diseases create revenue, and if you tell somebody alternate advice and get them out of the system and get them healthy, they're not generating revenue for everybody. That's a huge problem.
Yeah, again, that's why nobody was upset when I left the conventional cardiology practice, because again, I would kind of espouse these truths, very early on, and certainly very on in my holistic career. And ultimately, again, it's just bad for business. Again, why doesn't the Cleveland Clinic and the Mayo Clinic and all these big hospital institutions have big nutrition departments and really preventive, areas? They don't, because it doesn't pay the bills. And quickly, if someone tries to introduce that, then they will be quickly ushered out of that situation. And, again, that's okay. We're going to circumvent all that. We're going to talk like you and I are right now. We're going to share this information. We're going to take it directly to the people. And then the people are going to go back to their doctors and say, hey, I want a better approach. And if you don't have that, then I'm not going to, again, be your patient. And once that patient pool starts to shrink, as it already is for mainstream doctors, although, again, there still are 330 million people in this country, the majority of which are still very sick and do not understand about health and wellness. So again, we're not getting rid of the medical doctors, currently, but again, I certainly see a day, 10, 20, 30 years down the road when this type of practice is really commonplace.
I sure hope so. That makes me so optimistic. We talk about all the time the delta between the people that are getting healthier and finding this type of information versus the other people that are following all the standard advice, and their health is absolutely just deteriorating at such a fast rate. That split between the two is just growing and growing and growing. And it's getting so wide that you're right. That's what makes me optimistic as well, that we're going to be able to get this message out, because at some point there's going to be so many people getting healthier by doing the opposite of what they're told. That's going to carry this message forward. So before we get into the pillars that you talk about and the other things that you talk about, which I absolutely love and I really want to get into, tell us a little bit about the challenges as you started, you opened your clinic and you started doing things a little bit differently. You did mention financials. That is a financially very different thing. And I don't blame any doctor for not staying in the medical field and generating money doing it. I don't blame them, because you need to put bread on the table. What were some of the challenges you faced early on with going your own way?
Well, I mean, ultimately, I think that, as they say, cliche, right? We only go around once. And the proverbial, hey, when I'm on my deathbed and I'm surrounded by my family and friends, what do I want them to know about me? That I did it for the money. I didn't like my career. I knew that what I was doing was wrong, but again, I wanted to support everybody in this room the best that I could. I guess one could take that approach, and that may be right for some people. It certainly was not right for me. So in doing so, when you're, I was making over $1 million a year as a conventional cardiologist, and I say that not to brag, obviously, but I say it because of how lucrative it is, and actually, it's embarrassing that I was making that kind of money doing the wrong thing. But ultimately, yeah, I would start over on September 1st, 2012, with zero revenue. But listen, I think that when we continue with our truth, and we're able to explain it clearly, then the people will come to us. When we're doing the right thing, then the revenue tends to follow that. And I know it's easy for me to say, because I am a cardiologist and people would see me as the ultimate cardiac authority, therefore come to seek out my help. But again, I think that there are so many people who practice natural medicine and promote natural healthcare who are doing very, very well, opening up the eyes of people who are accountants and lawyers and people who drive, a truck. Like the number one demographic, if you will, that comes to see me is a truck driver. It's like my ideal patient is a 62-year-old guy who drives a truck, or maybe the woman who helps him or is married to him. I mean, again, so I do think, again, that we need to follow our path. And when we follow our path and we do it well and we fully commit to it, then we will have all the fruits of that labor.